Hi, my name is Thalia MK. I'm at Health 2.0 Conference Winter 2022, and I have with me Dr. Tariq Shadid, who is a consultant general surgeon and a medical director of Mediclinic Al Ain Hospital. You've also received an award for leadership, I believe. Congratulations for that. Thank you so much for your time. First of all, being a surgeon, being a director at a hospital, I know it's a tiring job, but it is a very people-serving job. Tell us about your company, tell us about your work.
Okay, yes, thank you. First of all, I'm very grateful for the recognition and the award. To answer your question, I'm the medical director of 84-bed hospital in the center of Al Ain. Al Ain is the most beautiful city in the United Arab Emirates. It's very green, it's very nice, everybody should come and visit it. And I'm really happy to be leading the clinical team in our hospital. I think we have a really amazing set of doctors and nurses, people with real dedication to patient care, people with real dedication to doing their job the best way they can. So I'm very proud of them. That's why you see me bragging about them. Let's say the challenges of a job like this, I think that's where you were going with your question, is because healthcare is a very competitive environment. I'm lucky to be working for Mediclinic, which is one of the biggest private care companies in the United Arab Emirates, as you undoubtedly know.
Services are amazing. I know, as being like I'm born here in Dubai, and I can see the Mediclinic everywhere. Once you go there, the services are out of out of this world.
Wow, I'm so glad to hear that. And that's why our slogan is expertise you can trust. I think that slogan really sums up everything that we do because we have the experts, and it's not enough to just have experts. It's important that as a patient you can put your confidence in them, and because you are going to have to, when you come for healthcare, you have a problem, right? That's why you go to healthcare, and you have to put your faith and trust in the people who are there to serve you. And I believe that this is the attitude that people who work for Mediclinic have. And as a medical director, I am always working on keeping that attitude alive, cultivating it, and making sure that people express that to the patient.
So, as you said, it's Al Ain Hospital. Are you planning? Mediclinic is planning, as the expertise and the services are amazing. Are they planning to provide those services outside Al Ain, in or all around the UAE, or even outside UAE?
Yes, but they're actually already doing that because Mediclinic is very present in Dubai. It's present in Abu Dhabi, expanding into other countries in the Middle East as well. And Mediclinic is a multinational company, so it's all over the world. It's got yeah.
I didn't have the idea because I just knew about it over here in UAE. I had no clue that it is outside. Amazing. So I would like to know, how do you think that this conference is going to help to promote your work, Mediclinic work, and their expertise outside Al Ain, outside UAE? As you can see, the people from all over the world are here. So how it's going to help you?
Well, I think it's actually a really great thing that a conference like this is being organized because we live in a time of transition. We've seen how the pandemic has pushed people into things that were already being developed, but they got an extra push, which is the digitalization of healthcare and making sure that you can now have teleconsultations, all that kind of thing. I think this is really going to influence how healthcare consumers are approaching healthcare and maybe even their entrance into healthcare. So yes, when we have a conference like this where all these new developments are being discussed by people from so many places in the world and from so many different companies also getting together and sharing ideas, that is what we need in order to make that transition. And what I foresee in the future, and I may be proven wrong, now I'm on camera, you never know, I might look bad, but I dare say that what I foresee in the future is that you might have, it's just like a small fantasy that I have, that you have like a Fitbit type of thing on your wrist, okay, which reads your pulse, your temperature.
Kind of already have with the
Yeah, okay.
smartwatches, right?
True.
Yeah.
So we have smartwatches, and then you have an application on your phone. Okay, you have an application on your phone. And what if that is connected to your medical record? Okay, in a completely private, privacy protected way, which when you type in some symptoms that you're having now on your application,
Rather than just going on Google.
yeah, and it automatically feeds your those data through the app into an AI, artificial intelligence, which gives you an advice which doctor to go to or which place. And if all that can happen simply from typing your symptoms instead of typing them into Google, just like you said, then we're in a healthcare revolution. And the things that I say now are technically actually already possible, almost. Yeah.
But I think so. People are still be kind of shy to do that, as trusting AI is one of the problems, because putting anything on the cloud or outside, like problems when it comes to diseases, nobody wants to share it with anybody. So I think one of the biggest work anybody with, especially with a medical person, have to do is to provide the satisfaction to the patient that nothing is going to go out and it is extremely private, and that should be binding. So apart from that, as you have received an award, an amazing award, how does it feel to be recognized for accomplishments, and what did it do to you today that you're gonna make the little change tomorrow?
It humbles me because I didn't expect it. So when something unexpected like that comes your way, you're surprised, and I think it pushes me to want to do even better. Because it now I feel that others from outside have recognized me. I have to prove them right. I have to prove that I'm worth this. Yeah, I have to prove that I'm worth it. I mean, if I have this plaque and I hang it on my wall, and somebody comes into my office and he sees outstanding leader, then I'd better be an outstanding leader. Otherwise, it looks silly. And just to get back to what you said before, you said something really, really important, and that's the privacy of the patients. And I think that blockchain technology now is the way forward. Not that I'm that technical, but I know a little bit about it.
I think so with everything online, everything on social media, your happy moments, sad moment, everything is online. Your diseases and your problems, which you don't want to share with anyone, should be private. And when you want to share it, it should be out. It shouldn't be out without your knowledge, and that privacy should be provided. And thank you so much for your time. Congratulations, and I hope to see you around. And if you want to contact him, you can contact him. Health is very important, and be kind to each other and take care of each other. Thank you, Talia MK, signing off.